It's Monday, January 31st, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Take a look at the article here. It was introduced into the Journal of Reproduction in Domestic Animals in 2012. It's entitled Efficacy of Ozone and Other Treatment Modalities for Retained Placenta in Dairy Cows. So they segmented out 5 different groups. One was given ozone and antibiotics. That was Group A. Group B was given only ozone. Group C was given a combination treatment of antibiotics. Group D was given parenteral cefixime, and Group E was given parenteral prostaglandins. So those are the different groups. Take a look. The ozone treatment groups, this is a summary. Groups A and B were found to be the most effective modality, resulting in the shortest period of open days, the smallest number of artificial inseminations until pregnancy, the smallest number of animals diagnosed with fever within 10 days post-calving, the highest percentage of animals pregnant within 200 days after calving, and the smallest number of animals culled because of infertility when compared to the other treatment groups. That's amazing. We need to take note of this. Now, there are some things to look at beyond that summary and understand. Okay, so here's the issue. Some antibiotics can be helpful, but they can also have some pretty negative side effects at times, and they don't do everything. They affect one element, but maybe not another. So what they say right here, the immediate postpartum administration of prostaglandins, oxytocin, and calcium was not found to be effective in preventing the retained placenta or hastening the separation and expulsion of retained placentas. So there's other treatments that we don't deal with here that are typically used in these situations, but they don't necessarily have a fantastic result or even any result whatsoever at times compared to just leaving the cows alone. So why ozone? Well, it's bactericidal, it's immune stimulating, and it's anti-inflammatory. For those reasons, it can be a very, very effective treatment. So what did they do? Well, I want to note that this study involved 200 dairy cows. Okay, so that's a significant amount over a period of time. You can go through and look at some of this other stuff, but I want to get to the protocol. So taking a look at the protocol, they use something called rigor spray, which is basically just an ozonated oil that's in a foam. So basically, again, ozone oil. This is something comes out of Italy. And they use 30 mL, so not a huge amount in this one. So they had that. They had the group with the different antibiotics and ozone. I want to focus on Group A and B. Those are the ozone groups. Group C is only antibiotics, and we'll compare those three and take a look at the results here on this chart. Okay, so Group A, you'll notice here that Group A and B have very similar results. So when we get to DO, which is days open, this is artificial insemination, fever. You can take a look down here. Clinical endometriosis, et cetera, et cetera. But you have a very similar result in the ozone and antibiotic group and the just ozone group, although slightly less effective with just ozone. However, when you compare just ozone to just antibiotics, it's significant difference in some of these categories. So you see significant rise in fever. You have a significant amount of days open in just the antibiotic group. You have a significant amount of clinical endometriosis as compared to just the ozone group. So it's pretty fascinating to see how ozone can be effective in these types of things. In this study, the ozone treatment alone and in combination with the parenteral antibiotic treatment was more effective when compared to the antibiotics administered parentally or the hormone treatment options for retained placenta in some of the criteria employed. At the same time, the differences within the two ozone treatment groups, A and B, were not statistically significant. So here's the conclusion. Owing to its noted advantages, it should be considered as a therapeutic option in routine dairy practice because of its potential to improve overall puerperal health and fertility in cows with placental retention. It offers a practical and relatively inexpensive treatment option for this condition because of its simple administration and lack of residues. There you have it. This has been 5 Minutes of Proof. Thanks for watching.